Well, hi, SilverCyclist. This is Don. Welcome to another episode. A little different, as you gather from the thumbnail. We're going to talk about plastic surgery and sort of aesthetic procedures. I think that you'll find this interesting. The gentleman that's going to talk to us is a longtime friend, Frank Feshner. Frank is a double board certified plastic surgeon out of the Boston area, has a tremendous practice, and helped me with some minor procedures some time ago, but we really got to know each other doing portraits. Some time ago, 10-15 years ago, I was a very active portrait and wedding photographer, and I had the great pleasure of doing portrait sessions of he and his family every year for many, many years as his young family grew. I was particularly taken by Frank's approach to his art, his craft, and the way he deals with people. He's truly a special person. And I think you'll enjoy this little clip. I had an opportunity to sit down with him. I thought it would be interesting. And while I certainly sort of believe that health and diet is the bedrock of really living well, as we age, there may be reasons why we want to enhance the way we look. And so I thought it would be interesting to ask him those questions. So it's a short video this time. I hope you'll enjoy it. All of his information and his clinic, which includes a full surgical suite, is located in the description box below. And I hope you'll enjoy listening to what he has to say. So with that, let's go to Frank. Dr. Feshner, tell us a little bit about yourself.
Well, first of all, professionally, I'm a double board certified facial plastic surgeon, which means that everything that I focus on surgically is collarbones up. So the most common procedures I perform are really related to facial rejuvenation, like facelifts, neck lifts, eyelid lifts, and the complementary procedures with that.
Okay. It seems to me that there are basically two general types of plastic surgery. Those procedures that are done to correct a medical condition or a defect repair, and those that are conducted to improve appearance. If that's true, and maybe it's not, but if it is true, how much of your practice is devoted to each of those?
Yeah. No, I think your description is correct. There's reconstructive plastic surgery, and then there's aesthetic plastic surgery. In my practice nowadays, it is really 99% aesthetic plastic surgery, designed basically to enhance, rejuvenate, improve the appearance of my patients.
Okay, so rejuvenation, there's a key operative word here. I have a hypothesis that as we age and enter our senior years or our SilverCyclist years or our boomer years, whatever you want to say, if you will, that society treats you better and with more belief when you look better, that is, when you look healthier and younger. Do you think there's any validity to that?
Well, I think there's certainly something to it. We may not want to admit it, but we do appreciate people the way they appear to us, right? And if you look, for instance, what is done in the advertising industry, right? I mean, it's rare that you see a 65-year-old person demonstrating the newest fashion or makeup or even exercise equipment. That's done by young, vibrant, athletic, pretty-looking people who are in their 20s most of the time.
Right.
On the other hand, there's a flip side to it. I think that if we feel good about ourselves, then we can also project ourselves in the best way. So it comes the other way around. So if my patients usually tell me that, listen, I feel great about myself, but when I look in the mirror, that does not fit. The mirror image does not fit. And they want to basically achieve the way they feel internally. They want to get there also with their outward appearance.
Interesting. Do you find that there's any correlation, at least among your patient base, with people who take advantage of those things that help them aesthetically and also for instance, are more scrupulous with their fitness or their diet? Do people that are interested have a rounded approach?
I would say so. I think that in general, somebody who is really paying attention to their appearance, they tend to be, I would say, the more fit people within our society. And they're usually people who always paid attention to their outward appearance. It was always important to them. They are, we all like to dress well. We like to groom well. Women in particular use makeup and go to the hairdressers and follow certain fashion trends. And they continue that also in the aesthetic world, whether it's through aesthetic medical procedures or surgical procedures. That's then a very personal decision. But I would say that is true. On the other hand, I also have seen patients who go through a surgical procedure, and that helps them to jumpstart later in life.
Interesting.
Actually, a quest to being fit, living a healthy life, losing weight, for instance. I see that all the time.
Interesting that there's a correlation both directions. Yeah. I think there's a common perception that women get the majority of these kinds of aesthetic procedures. Is that true in your practice?
Well, it certainly is true that our female population is by far the majority in my practice. But I can tell you is that the growing gender, percentage-wise, has been men.
Interesting.
And it's I think in contrast to what is a common belief out in the community maybe. It is really normal guys like you and me who have the procedure done. Like, for instance, I very commonly, men out of the construction industry come and wanting to look better and fit and their best. Contractors that say, listen, I'm in my early 60s. I compete with young 35-year-old guys. I have the experience, I have the know-how, but I feel like that the client, my customer, doesn't really see that. So I gotta keep up and they feel good about going a step further than maybe others.
That's very interesting. Well, what are the most common procedures that you perform that would promote a younger appearance?
Yeah. So, it starts all with non-surgical treatments. I would say that for most people nowadays, really they start with injectables, right? Whether it's the use of injectables to soften lines and wrinkles, like for instance, frown muscles or crow's feet and the like, and softening areas that hollowed out over time. We all lose facial volume over the years to basically soften the look. That is kind of a nice entry point because it comes with meaningful benefits that are lasting and no downtime. Now, when we go up the step, then laser treatments are very common to basically improve our skin. Our skin is the largest organ of the body and is constantly exposed to environmental factors, right? Primarily the sun. So UV radiation causes quite a bit of damage to the skin. So our laser treatments are designed to reverse the aging that the sun has caused and maintain a vibrant, healthy skin. And then, as mentioned before, on the surgical side, the most common procedures I perform for rejuvenation purposes are facelifts, neck lifts, eyelid lifts, and we combine that commonly with some plumping procedures like filling areas of volume loss.
Okay, that's great. Well, any last thoughts?
Well, I think it was a pleasure actually starting that conversation. Because I think this is going to be an ongoing trend in the society. Aesthetic medicine and aesthetic surgery is here to stay, and I can tell you there's nothing more rewarding for me personally to actually see a patient achieving their goals and feeling truly good about ourselves. That's what it's all about.
Fantastic. I agree with you completely. So thank you for your time. I'll see you on the bike. I'll see you around Newport.
Sounds good. Thanks, Don.
Bye. And thank you, Dr. Fechner. It was my pleasure. Frank's information will be in the description box below. I hope you'll click on his link and give him a look. He's a tremendous person, and I look forward to having you subscribe. Join the family.